and look at your eosinophils. Look at your full
the
differential.
normal percentage up to 5 days?
Up to 5 days, if the percentage is the band cell neutrophil ratio less than 0.2. Less than 0.2. If it is more than 0.2 and you are seeing eosinophils with it, then it may not be sepsis, but you need to take care of this child. Either he will go into sepsis next day or has just come out of sepsis. Please understand. So each day the smear is normally every day we get a smear from that. Serially we get the smears from these babies. And we have been correlating with cultures.
Does it correlate with CRP?
CRP also, but CRP is a very dicey test. Because newborn babies first 24 hours CRPs after delivery is high. So CRP does not hold that importance. But if you are doing it serially, then it may be. But to do that serially, you need to poke the baby again and again, which is not feasible. Here they just take the poke, take a prick, and that's it. CRP is not a very good parameter. First 6 hours, all normal deliveries, CRP is high. Yes, please. Yes, please. Yes, please.
And being treated.
Yes.
Some chelating agent.
Yes.
Now, for follow-up, whether the discipline will be.
Disappears completely. This gentleman is at 14 grams now. This gentleman is a Bohri gentleman with an industry, and after that, once the report came, he's absolutely, he comes to the clinic, he's still diabetic, comes for his blood sugars. But hemoglobin is 14.8, absolutely normal smear. All stippling gone.
And whether the stippling is affected by anticoagulation or it is equally well in anticoagulation?
Coarse stippling may be seen in anticoagulated sample also, but the fine stippling will be missed. Fine stippling of thaltrates is 100% missed, 100%.
But of lead poisoning will be
Yeah, you should be able to pick up because that's coarse stippling and it stays. It stays. Yes?
After correction,
Yes.
the parties of counter cell counter, we can run the sample immediately or we have to give some time for mixing the ATT?
No, it has to be mixed properly, homogenized, wait for 5-10 minutes, then only run it, not immediately. Yeah.
Regarding quality control of hematology tests,
Yes.
we have an external quality control program for biochemistry.
Biochemistry.
So how do you run?
We have quality control program for 2 parameters. One is your internal control is on your counters. Please run your controls every day. For your counters, before you start your routine work, the first thing should be what we have been following in our lab. 1 sample of yesterday. 1 control every morning. These are 3 controls, low, normal and high, available from Biorad. We are buying them from Biorad, and these controls work very well for 1 month. So first we do the hemat control, then we run yesterday's sample. I have actually 2 machines. Paresh keeps running between the 2 machines. But I run 1 machine one day, next day the other machine. It must give me the same reading what it gave me yesterday on the other machine. Then only I proceed. Because otherwise my patient keep coming every time and I don't know which machine at the last time it was done. I cannot have a variation between the 2 machines. So the first thing to do, switch on your machine, run your Biorad control or any other. I don't think there is any other hemat control which is available at the moment. Run your Biorad control. What I do is I buy a set of 3, open 1 at a time. First run 3 and then see that all 3 are okay. Shut it off, keep it in the fridge, 1 every day. For 1 month it works, throw it away. Take off the other, run it, throw it away. And every day, yesterday's sample is run. So that is your internal check. Second, we are participating in All India Institute's Hematology Control EQUAS program. They send you, all of you can write to Dr. Renu Saxena at All India Institute of Medical Sciences. They tell you, they send you a vial, 2 vials. One is for manual count, one is for automated analyzers. They send you retic slides and they send you a differential slide also. So you can also participate. An institute pays 500 rupees, an individual pays 1000 rupees. per year, which is nothing, I think. And these controls come almost every month.
If we run yesterday's sample,
Every
after
3
6
months.
hours you are going to change the...
I don't look at the NCV, but I definitely look at the HB, WBC, and platelet also does not vary. I've been running it for years now. I've had no problem. No problem. And this hematology quality control is a must with your counters also. Please remember, you cannot depend on your counters. After all, these are machines. They show a lot of variations, lot of drifts. People just buy the machine and think, okay, that's it. All your parameters are okay. I'm sorry. You'll be shocked how wrong readings can come out of these parameters. You have to run your control every day, I'm telling you. Every day we run this while, then only we proceed further. Otherwise we don't. And you must do that. Manual or counters, all have these errors. Whether no, you can't give a wrong report. And that is, if you give one wrong report to your patient who is 14 grams and you give 10 grams, you've lost that patient. With that patient, you've lost 10 other patients. And it's much better to spend that one vial of control. Believe me, it is worth it. It is worth it. Because for certain investigations, no clinician will pardon you. अगर wrong hemoglobin हो गया, blood sugar गलत हो गया, ये छोटी मोटी चीजों में बिल्कुल छोड़ेगा नहीं कोई आप. You have to have a correct value and please correlate with your smear. If you find कि smear ठीक नहीं है, अब ये तो WBC तो 16,000 लग रहा है और यहाँ तो 6,000 दिखा रहा है मेरा काउंटर, पकड़ो इनके कान, बोलो आओ, come and see, my controls are coming okay, my everything, your counter is not giving me correct reading. You people must look at your smears carefully. A well-formed smear. अब तेल में ले जाके सब ल्यूकोसाइट्स रख दिए तो उसमें आप क्या टोटल काउंट और डिफरेंशियल काउंट पे ओपिनियन दो. Your quality check is with you and you must do it every day. Every day.
But which one do you prefer, either internalized or ED1 for platelet count?
I am using EDT, total EDT. I don't use heparin for routine hematology, except for markers and other things. I don't use it.
But do you have any correlation for primary infertility cases in that I am seeing maximum is usually placed there?
I don't know. I have not noticed, but maybe I'll start looking at it now. I have not noticed that. Maybe there might be something.
Madam,
Yes.
in PO, is there only like the total count is normal, but the differential shows neutrophilia.
Yes.
85, 90.
Yeah. Two
So how
things.
you?
Two things. If it's a PUO case, either the PUO is in the first 24 hours, then the count has not risen, but the lymphopenia has occurred already, and within 24 hours the count will start rising. So that neutrophil leukocytosis, so that's why if you have a normal count and you have high neutrophils, mostly you will find this happening in the first 12 to 24 hours of this fever, and usually seen in any fever, whether viral or bacterial. And that is why for such a smear, don't put an opinion. Just give your differentials and ask the clinician to repeat a smear or the counts the next day. And usually you will get your answer. If the count is due to viral infection, this lymphopenia is very significant. Within 24 hours, you will start seeing the atypical lymphocytes. The count will remain the same. If it is bacterial, the count will multiply. You will see.
How much variation is acceptable between two machines, two counters for the counts?
For the counts,
Yeah, if you run the same sample on two different machines.
I go by the value. 10.2 है तो चलो 5% तक मान जाएंगे. 10.4 है, 10.3 है, accepted. 10.6, 10.8 हो जाए, we don't accept. I bring it down, we change, we do the parameters again, we run it on the same machine again, we say okay, कल गलती reading तो नहीं था, you know, then we do that. So if you have two machines, if you have one machine, then there's no problem.
Thank you, madam.
Thank you.
Again, on behalf of our association, I request Dr. Mrs. Ratnaparki to give a memento to Dr. Mehta. Please, ma'am. request Dr. Abhay Bhave to come in the dais. Now after the lecture of peripheral blood smear examination, the diagnosis of hematological diseases cannot be completed without bone marrow aspiration and bone marrow biopsy. So today Dr. Abhay Bhave is with us to discuss this topic. Dr. Bhave did his MD Medicine from Lokmanya Tilak Medical College and Science Hospital, Mumbai. He is fellow in hematology from CMC Vellore. He received fellowship from Sydney, Australia. He has 6 international publications on his name. He has a special interest in bone marrow transplantation. At present, he is attached to Lilavati Hospital, Sushruta Hospital, Holy Spirit and Mokad Hospital, Mumbai. So without taking much time now, I request him to start his lecture. Dr. Bhave was late, so first we should welcome him. I request Dr. Ajit Zunagade, who is our Vice President, to first welcome before starting the lecture.
Have a session with you over here. Absolute honor. We've had a session in the past also together, and it was an enriching experience for me. She's given a beautiful, detailed lecture on peripheral smear examination. So that's my job a little bit easier.